السلام عليكم. This is the extraocular muscle movies which was not attached to the presentation. أنا آسف، هحط الموفيز هنا وتقدروا تاتاتش to the presentation وتتفرجوا عليها بعد ما تخلصوا البرزنتيشن بتاع extraocular muscle. شكرا والسلام عليكم.
Extraocular muscles are controlled by cranial nerves 3, 4, and 6. Patients with cranial nerve damage or extraocular muscle dysfunction often report diplopia or double vision. A patient may report tilting his or her head to attempt to correct the diplopia, especially with cranial nerve 4 or 6 dysfunction. To test extraocular movements, specifically pursuit eye movements, ask the patient to follow your finger without moving their head. Patients often need reminding to not move their head and just follow with their eyes. Draw a wide X and H, pausing at the end of each movement, and then note any movement that is not smooth or full. This will test the 6 cardinal positions of gaze. This diagram shows the cardinal positions as well as the muscles that control eye movements. If no deficit is found, write full EOM. Document this on the alignment section of the chart. Let's observe testing extraocular movements in a patient encounter. Okay, sir, I'm going to check your eye movements. Could you keep your head still and just follow my finger with your eyes, but keep your head still, okay? Don't move your head. Just follow with your eyes. The third cranial nerve controls most of the eye muscles. If a patient has a third cranial nerve palsy, the affected eye will be deviated down and out. The following patient examples have been taken from Dr. Trobe's videos at the Kellogg Eye Center, University of Michigan. The third cranial nerve innervates the levator muscle, and you can see this patient has complete right upper eyelid ptosis. The patient can abduct his right eye, but has difficulty adducting his eye. He also has difficulty with supraduction and infraduction of his right eye. This is a right third cranial nerve palsy. In a sixth cranial nerve palsy, you may see the affected eye deviated inward and nasally at rest. The sixth cranial nerve innervates the lateral rectus muscle, which controls the eye's ability to abduct. This patient is looking straight ahead, and his right eye is deviated nasally. When he looks to the right, his right eye does not abduct. He is able to look to the left and adduct both eyes normally. This is a right sixth cranial nerve palsy. Test yourself with the following example. You see a patient with the findings in this slide in clinic. What is going on with this patient? Feel free to pause the video. This patient has a left sixth cranial nerve palsy. When looking straight ahead, this patient's left eye is deviated in nasally. They are able to adduct the left eye normally when looking to the right, but they are not able to abduct the left eye when looking to the left. When testing eye movements, emphasize the need for the patient to keep his or her head still and only follow with their eyes. More examples of abnormal eye movements can be found online.
Have the patient look directly at a target at least 10 feet away. Cover the left eye and watch for a movement of the uncovered eye. Repeat this step a few times. Then do exactly the same thing in covering the right eye. If no movement occurs in the uncovered eye, the eyes are aligned. Here is a patient with esotropia. The left eye is deviated inward. As the fixating right eye is covered, the left eye moves outward to pick up fixation. As the non-fixating left eye is covered, there is no movement of the already fixating right eye. Here is a patient with exotropia. The left eye is deviated outward. As the fixating right eye is covered, the left eye moves inward to pick up fixation. As the non-fixating left eye is covered, There is no movement of the already fixating right eye. Here is a patient with a left hypertropia. The left eye is deviated upward. As the fixating eye is covered, the deviated left eye moves downward to pick up fixation. As the non-fixating left eye is covered, there is no movement of the already fixating right eye.
شكرا وبعتذر مرة تانية.